start by talking a little bit about some of the statistics and how serious this is for seniors. It's serious certainly for all ages, but in particular for seniors. So to give a sense of statistics in the region, we had at our 2016 census data about 90,000, a little over 90,000 seniors over the age of 65 living in the North Simcoe Muskoka region. And that extends right from sort of the south of Barrie, right up through Huntsville, over across Midland and down through Collingwood. So within the province, we sit higher from a percentage perspective. We have 19.6% of our population are seniors in this region. 8.2% are those over the age of 75. In the region, we also know we have 26 long-term care homes with a little over 3,000 beds, 3,065 beds. And we also in this region, I believe, have about 42 retirement homes. And when they are full at full capacity, that equates to about another 4,000 individuals at full capacity. So we certainly know that seniors are a big portion of our population in the North Simcoe Muskoka region. We also, when we look globally at the data, in particular early stuff that was coming out of Italy, seniors typically have a higher case mortality when it comes to COVID-19, which means that they are dying of the disease as opposed to the younger populations. So this morning there happened to be a World Health Organization, the European branch, did a presentation, and it was their regional director. And he was talking about the number of cases. And in his statistics, he identified that 95% of the deaths are in individuals over the age of 60, and that about 50% of those globally are over the age of 80. Now, having said that, of all the deaths, there are a lot of seniors, most of them are seniors that are dying. However, in terms of individuals dying from the disease, it seems to be running around 15% globally. Some stats coming out of Italy about 2 weeks ago showed that about 20% of individuals over the age of 80 who contracted the disease were dying. So when we look at the overall statistics, there may be a lot of individuals who are seniors that are dying from COVID, but there is also a lot that are recovering as well. And so that's about an 85% recovery rate for those that contract it. So it's serious for all ages, but most specifically serious for seniors. Part of the reason for that is because of the physiological changes with age that seniors have. Sometimes their immune systems are a bit more compromised, and sometimes many of them have what we call comorbidities or underlying diseases. The ones that tend to be a bit more predominant from what we're seeing in the literature and what we're hearing are the cardiovascular diseases, the hypertension, the diabetes. And I think out of the presentation this morning, the regional director was saying that about 8 out of 10 of those who are passing away have at least one underlying medical condition. So the chronic comorbidities tend to contribute to the factors. So in terms of protecting our seniors, there are a couple of things that we should all be taking on. I think that as much as seniors are more at risk, we all as a society have the obligation, and we all need to come together to sort of protect our seniors at this particular point in time. So the whole piece around social distancing is really important. The hand hygiene is really important, making sure you're washing your hands, making sure you're cleaning surfaces, because COVID will live on some surfaces after. So making sure you're cleaning surfaces well. And the other piece then is also staying at home. Only go out if you have to for essential trips, to doctor's appointments, to pick up medication, for some grocery shopping. It's great because some of the grocery stores have got specifically allocated hours for seniors, so that's really helpful to them. But really it's the whole concept of flattening the curve, and we keep hearing about that. And the thinking behind that is really the fewer cases we have, the better that they can be supported within our healthcare system. So if we can prevent the spread and sort of protect our seniors, then when they do require the services in the system, they'll be much better prepared. The other piece that's really important is to recognize that and keep an eye on seniors because they may or may not necessarily present with typical symptoms. So usually we're looking for, when you're looking at COVID, we're looking for fevers, respiratory illnesses or respiratory infections, dry coughs, sometimes some GI symptoms. But there's many illnesses where seniors can sometimes present differently, and we have to be careful and watch for that. Seniors will sometimes not have a fever. Sometimes they'll present with increased confusion. Sometimes they will present with increased falls. And so it's those atypical presentations that we also have to watch out for. So in terms of supporting our seniors, what else can we do in addition to sort of protecting them and the social distancing piece and keep them safe? One of the key things that our seniors are facing, in addition to the risk of the disease, is the whole piece around social isolation. And so individuals who are used to having social contacts and social supports are all of a sudden isolated. Retirement homes and long-term care homes have been shut down for both visiting and volunteer programs, meaning that there is nobody going in and out of those facilities aside from healthcare workers, except in extreme circumstances, they will let some visitors in. We have many of the community programs have been canceled, the congregate or the group program kind of things, the adult day programs, which was really important to caregivers to give them a bit of respite and a bit of a break so that they can continue to care for their loved ones and keep them at home, in particular those usually that have dementia or other medical illnesses or that need a lot of support, and families struggle sometimes to keep them at home. Some of the Meals on Wheels programs around the region have been canceled, which means that those seniors that were getting 2 or 3 warm meals a week well balanced and nourishing meals a week are no longer getting those. So I think, it's really becoming increasingly difficult for these seniors to stay socially connected. Oftentimes, if they relied on loved ones or caregivers to come in and check on them on a regular basis, and they're not coming in and checking us regularly, we could be running into food issues. Sometimes medications start running low, but equally important, when the family was in, they would often pick up on maybe some subtle changes that were happening, and now it's taking longer to identify those, which means there could be underlying medical pieces that are going on that are taking longer to identify. So it's really, really important that we find ways to stay connected to our seniors in the community, that we help out our neighbors where at all possible, but it needs to be done safely. So if you've got an individual in your neighborhood and they have an interest, it's always important to check and see if they have an interest. If they have an interest in receiving support and some help, bringing them groceries. If you have any symptoms or if you've been in contact with anybody, you should not be doing that. If you have any contact with anybody who's had COVID, you should not be bringing them groceries. But, if you can help in any way, support them, that would be brilliant. It's going to be really important for these seniors as well to stay connected. So whether that's, you should be calling them or connecting with them on a daily basis, if it's family or caregivers, checking in, making sure they're okay. We should also be trying to find ways to connect them to activities. So there seems to be more and more that's happening virtually. And so whether it's exercise classes, whether it's encouraging them around chores, because chores keep them busy, chores keep them active, things around the house. Seniors should be setting up some sort of a regular schedule, even when they're in their homes, making sure that they're getting a little bit of exercise every day and activity, that they're eating well, that they're sleeping well, that they're staying mentally alert. There's some great activities online that you can find, museum tours, virtual museum tours, virtual art programming and things like that. So the more active you can stay, the better it is. I think what we're hearing globally is sometimes for some people, the healthier they are when they contract the disease, the better outcomes they can have in the long run. And so it's really important over this period of time to stay active and well. So I guess I would say in wrap up or in conclusion, there's a couple of key messages. This certainly is a serious disease, something that we have not seen before. It's unprecedented in terms of how it will be approached and the impact that it will have on our aging population. I think that there are a couple of key pieces that we have to keep in mind. One is watching for some of those atypical symptoms we may or may not necessarily know, making sure if you see symptoms that you know what to do about them, you understand self-isolation, you understand the strategies to provide care for somebody who is having symptoms, and there is great information on the public health agency websites around that. So the second thing I would say, in addition to the watching for atypical symptoms, is around staying connected with seniors, trying to minimize their social isolation. Many of them are already getting phone calls from multiple agencies, so it's making sure that they are connected with some sort of an organization, that family stays connected, and we try and keep them as well and as safe as possible at home, keeping them active both mentally, physically, from a nutrition perspective, just to keep them going and as strong as possible. And then the third piece is really around our responsibility as a community. It is integral, it is vital that we recognize that our actions are impacting everybody. These seniors are particularly vulnerable, and so we have to all do our part to flatten that curve. Social distancing, hand hygiene, stay at home. Let's try and keep our seniors as safe as possible for as long as possible. They're an important part of our history. They connect our history to our future, and we want to try and keep them around for as long as possible.